Today, are you too old to become a nurse in Australia? Let's come to listen to Nurse Jong with my friend experience age of 60. In Australia, the age is not a problem to become a nurse because of there are a lot of ways that people can become a nurse in different age if you want to. Some of the nurses say, "Oh, my friend, she's 55. She wants to go back to the nursing university, the nursing college to become a nurse. Is that too old?" In Australia, the way of living, you can start to learn and become a nurse in any time. We know that a lot of people, even they're 60, 65, even 70, they still want to achieve of their study and become successfully complete nursing degree. How good is that? So, age is not the boundary to become a nurse in Australia because of Australia is accepting any age to go back to study. If you can study, just go ahead and do it. So, are you too old to become a nurse in Australia? Not at all. Let's come and listen to the point of view. There are a lot of reasons people want to become a nurse. I got my friend, but they might say that, why? I'm too old to become a nurse. Why I want to become a nurse? So many ways they have their reason. Some people they want to achieve something when they nearly retire because they don't have opportunity when they're younger. So that's their reason. So they ask themselves, can they handle the nursing study in the university? This is a question as in Australia, as you know, you can become a EEN. The course will be studied in TAFE or in private college. And then after you finish, you become a EN with work under the RN. The type of nurse is different kind of nurse. You can do it in any age. Some people they ask themselves, will I be fit to work or study in nursing? Oh, any old age can apply the nursing, but will you get accept is another point. You can welcome anybody to become a nurse, and in the nursing profession, it's up to you. If you want to study, why don't you try it? And you will know that you will fit in the nursing study in the college or in the university or not. Don't doubt yourself. You have to start to do it first, and then you will be able to know yourself. If you keep doubting, question yourself, you never start. And then when you start, you might got a lot of things challenge you while you study. You make it, you achieve it, you finish, you become a EN or you become a RN, and you might have a question again. Will I be able to handle the challenge in the job workplace? Oh, I don't know that I can do that quite of the job which is too busy. Again, start doing that and then you will know that you can or cannot. Never stop your mind before you start. You need to do it first and then you will know that you will fit in that job, you will be good in that job or not. At least you complete your study, you become a EN or RN. You don't need to be working in the hospital all the time. There will be different type of nursing that you can pick. You can become a nurse educator, you can become a clinical instructor. It's a lot of things that you can do. You can become a work in the practice is a doctor clinic, a lot of work, or you can become a nurse, a community nurse. This type of job doesn't need to work in the hospital all the time. So don't doubt yourself. If you start to thinking to go back to learn or study and become a nurse, just do it. Don't concern about your age. Age is not the problem, it's about your mindset. If you set your mind to start doing that and you want to achieve it, you can do it. In Australia, become a nurse as a mature age student. There will be a pathway. You can go through entry the university with the bachelor degree of nursing and become an RN. Or you want to become an EEN, so you go to TAFE. They will offer about 2 years course study. Or after that, you might take a diploma of nursing, another 18 months, and then you can become a EEN, which is another course. Or you just want to be an ARN, assistant in nursing, so you just do a course. So age is not a problem. It's about yourself. Do you want to do it or not? If you want to do it, start and do it. Kick it off. I am encouraging you. If you got the idea, you want to become a nurse in the old age. Age is not a problem. The problem is about your thinking. You have to set your mindset to achieve the goal. And then if you make it, you qualify to become an EN or RN. So go for it for the workplace, and you will know yourself that you're able to complete the whole work or not. Don't make yourself too scared of anything. Feeling that you have might stop you to go further. So try to control your feeling. Are you too old to become a nurse? For me, I don't think so. Anybody can study in age mature. So don't set yourself and underestimate yourself. You can become an RN. I went back to nursing university to complete AIN, RN master degree. I completed and I finished the whole process when I was 52 years old. So, see, I'm old as well. If I can do it, you can do it. Are you too old to become a nurse? No, in Australia.